Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of obstetrics is endocrine and neurological complications in pregnancy. We divided the lecture into 5 sections. In the first section, we will talk about the diabetes mellitus and what are the implications of diabetes on pregnancy on the disease. And then also we will talk about the implications of disease on pregnancy. So both how the diabetes mellitus affect the pregnancy and what are the effects of pregnancy on diabetes mellitus, and also how we can manage diabetes during pregnancy. Then in the second section, we will talk about some other complications of endocrine system, which is the systems that involves the hormones of the body. So in this, we will talk about the parathyroid disease, or what are the effects of disorder of parathyroid gland during the pregnancy. Then also we will talk about pituitary tumors in pregnancy and also adrenal diseases. Adrenal are the glands present on top of the kidneys and how they are affected during the pregnancy. Then third, we will talk about some thyroid hormone disorders. Thyroid gland is present in the neck and it produces the hormone thyroxine. So we will talk about what are the effects of hypothyroidism or low thyroid hormone level during pregnancy, and what are the effects of hyperthyroidism during pregnancy. Then in the fourth section, we will talk about some neurological complications during pregnancy, like multiple sclerosis and migraine, and also one very other important topic, Bell's palsy. And then in the fifth and final section, we will talk about epilepsy. What are the implications of disease and pregnancy? How epilepsy can be managed during pregnancy, and what are some other causes of seizures in pregnancy besides the epilepsy. So all this will be covered in our today's lecture, which is endocrine and neurological complications of pregnancy. So to learn more about this topic, keep watching sqadia.com.